All right. Ready to dive deep into some osteopathic therapy today? We're taking a close look at hands-on approaches, specifically
Oh, yeah.
the work of Dr. Erik Gandino.
I think people are going to find his work fascinating.
He's got over 20 years of experience as an osteopath, but his approach is a little different.
Yeah, most people think of osteopathy, they think, oh, this muscle's tight. But Dr. Gandino, he really zeroes in on the why. Like, why is that muscle misbehaving? He calls it receptor dysfunction.
Okay, so instead of just trying to loosen things up, it's more about figuring out the root cause.
Exactly. Like, you could just silence a fire alarm, right?
Yeah.
Or you could find the actual fire and put it out. That's what he's all about.
I like that analogy. That makes a lot of sense.
Mm-hmm.
And he actually suggests that the order in which you apply different techniques can make or break the treatment, right?
It all comes back to those receptors.
That's fascinating. So it's like a personalized recipe for how you approach each person's pain.
Absolutely.
So how does he even begin to, organize all the different hands-on techniques that are out there?
So he breaks them down into 5 categories. And just as a heads up, this is a simplified framework.
Okay.
It's not an exhaustive list
Right.
of every technique.
It's like a starting point for our deep dive.
Exactly.
So hit me with category 1. What's that all about?
All right. Category 1 is all about approximating tendons and fascia. So think techniques like counter strain, where you're gently moving the body into specific positions to reduce tension on the nervous system.
So it's more like coaxing the body into relaxation. You're not forcing it.
Exactly. And the really interesting thing about this is that you're actually revisiting the position that likely caused the strain in the first place. And of course, this is done very gently, but it's almost like you're taking that muscle back to the scene of the crime,
right,
and allowing the nervous system to kind of hit the reset button.
Clever.
Yeah.
All right, so that's category 1. What about category 2?
Mm-hmm.
I'm guessing this involves a bit more action.
You got it. Category 2 is all about those direct muscle stretches that I'm sure a lot of people listening are familiar with.
Right.
So we're talking, thrust techniques, springing, or even just good old-fashioned stretching. These techniques are really targeting the muscles and fascia themselves to elicit certain responses from the nervous system.
But knowing Dr. Gandino, I'm guessing there's a reason why he doesn't just stop at stretching.
You're catching on quick. So while stretching can definitely be helpful, it doesn't always address the root cause of why a muscle is chronically tight. It's like trying to reason with someone who's already shouting at you.
Okay.
You need to kind of help them calm down before you can have a productive conversation.
I like that.
And that's really what these other categories are going to get into. It's how do we calm down that nervous system so that stretching is actually going to be effective?
So it's about addressing that underlying tension first, and then you go into the stretching.
Exactly.
Okay. So what's category 3 then?
Category 3 focuses on what we call agonist contractions.
Okay.
And this is using very controlled contractions to actually relax those overactive muscles.
Wait, so instead of stretching a tight muscle, you're actually contracting it.
Yeah, you are. And it works wonders. This is something we use a lot in muscle energy techniques. And it's all about retraining those muscle patterns.
It's almost like outsmarting your muscles instead of trying to overpower them.
Exactly.
I like it.
And that's a great segue into category 4, because just like category 3, it uses muscle energy, but with a twist.
Okay.
Instead of contracting that tight muscle, we're focusing on its antagonist, the opposing muscle.
Interesting.
And this indirect approach can be really, really effective for releasing some of that deeply ingrained tension.
So it's about restoring balance between those opposing muscle groups.
Exactly.
Okay, so we've got 4 categories down. What's the final one?
All right, category 5 is dedicated entirely to fascial tension modification.
Fascia. I think everyone listening has felt that feeling of stiffness or restriction that just won't quit. And that's often our fascia crying out for attention, right?
You're absolutely right.
Yeah.
Fascia plays a huge role in how our bodies move and feel. And Dr. Gandino actually breaks category 5 down even further into 2 subcategories.
Okay.
He calls them restoring joint mobility and direct fascial treatment.
Okay, let's unpack those a little bit, because I have a feeling that's where a lot of aha moments are going to happen for people listening.
Oh, for sure. So that first subcategory, restoring joint mobility, that's really about addressing those fascial restrictions that make our joints feel, stiff,
right,
or stubborn, those knots you get that even stretching doesn't seem to work out.
Yeah, like they have a mind of their own.
Exactly. And so those are going to require some more gentle, specifically targeted techniques to really get in there and release those restrictions and bring back that joint freedom. Now, that second subcategory, direct fascial treatment. This is where it gets even more interesting, because this uses techniques with varying pressure and movement to actually stimulate different receptors within the fascia itself.
Okay, so that sounds both intriguing and a little mysterious. What's the goal with that kind of direct approach?
Well, it kind of depends on what we're going for. Some techniques are aimed at pain relief, others might focus on improving circulation, but here's the really fascinating part, is that some of these techniques can actually influence how the fascia itself behaves, making it more fluid and responsive over time.
Wait, hold on. So you're telling me we can actually change the way our fascia behaves? That's incredible. So how does that even work?
Well, one concept that Dr. Gandino emphasizes is something called tixotropy. And remember earlier how you were saying how after a hot shower, your lower back just feels amazing?
Oh, I do. Yeah, it's like that heat just melts the tension away.
That, my friend, is tixotropy at work.
Okay.
So tixotropy, in the simplest terms, just refers to a substance's ability to change its viscosity.
Okay.
Think like thickness or fluidity
Right.
in response to things like force or pressure or, in your case, heat.
So you're saying my fascia is actually changing its consistency?
It is. Fascia has this amazing ability to shift between a more gel-like state, which is when we feel that stiffness, that restriction, and a more fluid, sol-like state. And a good way to think about this is like, think about honey. Okay.
If you leave honey undisturbed, it gets thick and sticky, but if you stir it up, it becomes smooth and fluid.
Okay, that makes total sense. So movement and heat are like that good stir, encouraging our fascia to be more free-flowing.
Precisely, and that's actually one of the reasons why we warm up before exercise. We're increasing the blood flow, we're increasing the heat in those tissues,
Right.
including the fascia, and that helps to kind of prime them for movement and make them less prone to injury.
So it's like preheating the oven before you bake. You need to get to that optimal temperature, or in this case, that optimal condition, for things to really work well. Exactly. And it's the same with these manual therapy techniques, especially those in that category 5B, the direct fascial treatment. They're leveraging this tixotropic nature of the fascia. So by applying these specific types of pressure and movement, sometimes even heat, therapists can actually kind of unstick and restore that natural fluidity to fascia that's become restricted.
Wow, it's like giving your fascia a targeted massage from the inside out.
It really is, yeah.
That's amazing. So let's go back to techniques like counterstrain for a moment.
Yeah.
We talked about how it gently coaxes the body into a position of ease. How does that actually play out in a treatment session?
Sure. So let's say someone comes in, they've got that classic tension between the shoulder blades, right?
Oh, yeah.
A counterstrain practitioner would use their hands to actually feel the muscles in that area. And they're looking for what we call tender points.
Those sneaky little knots that always seem to be hiding in our backs.
Exactly. And once they locate that tender point, they would then guide the patient's body into a position that actually shortens the muscle that's causing the problem.
Wait, shorten it. I thought you want to stretch it out.
It seems counterintuitive.
Yeah.
But by shortening the muscle, you're essentially taking it back to the position where it likely first became strained or overstretched.
Okay.
And that allows the nervous system to kind of recalibrate and release that tension that's been held there.
It's like hitting the reset button on those poor, overworked muscle fibers.
Exactly. And because you're not forcing the muscles into a stretch, it tends to be much more tolerable for people who maybe have difficulty with traditional stretching or are dealing with acute pain.
So if someone is dealing with chronic tension, this gentler approach could be a game changer.
It can be really, really effective in those situations. And it highlights something really important, which is that we have to approach the nervous system with, understanding and finesse. It's not about forcing it.
Right. Like you said before, we need to help it to calm down before we can have that productive conversation. It makes you wonder, though, are those more direct techniques like stretching always enough to get to those deeper patterns?
That's a really good question, because sometimes those muscles are really stuck in that, shouting state. That nervous system is just constantly telling them to stay contracted.
Because of stress, bad posture, old injuries even.
All of the above. And so even if we're stretching those tight muscles, we might not be addressing the underlying reason why they're so tense in the first place.
It's like putting a Band-Aid on a wound that really needs stitches. You're not getting to the root of the issue.
And that's where those other categories like the agonist and antagonist contractions become really important.
Right, because they work more directly with the nervous system to try and reset those patterns.
Exactly.
Like with muscle energy, instead of just stretching your hamstring, you might contract your quad, which is the opposing muscle, to help release it.
Now you're getting it. And the choice of which muscle to target, how we're going to work with it, all comes back to those receptor dysfunctions that we talked about before.
Okay, so it's all starting to come together now. It's like each technique is a different tool in the toolbox, and understanding those underlying mechanisms, that's what helps you choose the right tool for the job.
You got it.
I'm thinking about those tables in Dr. Gandino's work. He talks about the different types of contractions: isometric, isotonic, oxytonic.
Yeah.
Are those examples of the detail that therapists use to kind of fine-tune their approach?
Absolutely.
So it's not just about knowing the techniques, it's about understanding the why behind them.
Exactly. And that's what makes this field so fascinating.
Yeah.
It's this really beautiful blend of the anatomy, the physiology, and also just the art of listening to the body.
hmm It really highlights how personalized this type of therapy can be. It's not just a one-size-fits-all approach.
Not at all. And that's what's so important to remember. There isn't one magic technique that works for everyone, just like there isn't one single cause for why we experience, pain or stiffness. It's about really listening to each person's body,
Right.
and tailoring the approach.
Which is why, having a skilled therapist who understands these nuances is so important.
Absolutely. It's like having a detective on your side, piecing together all those clues to unlock your body's full potential.
I like that.
And you know what? The more we understand about how our bodies work,
Right.
the better equipped we are to, ask the right questions, advocate for ourselves.
Absolutely.
Really take charge of our own well-being.
Right. This whole deep dive has honestly given me so much to think about in terms of my own aches and pains.
Oh, yeah.
Yeah. I feel like I have this whole new vocabulary now for understanding how my body moves and maybe what's holding it back.
I love that. That's what I love to hear. That's the beauty of diving into this stuff. It's not just about acquiring knowledge. It's about what you do with it,
Totally. So, as we wrap up our exploration of Dr. Gandino's work, I want to leave everyone listening with a thought. We covered a lot of ground today, from those sneaky receptor dysfunctions to that almost magical fascial tixotropy.
It's pretty amazing stuff.
It is, and it all comes back to this. Your body's incredibly complex, but it's also incredibly adaptable. So as you move through your day, pay attention. What helps you feel more at ease? What brings back that sense of freedom in your movement, those aha moments? Those are your body's way of kind of guiding you towards a deeper understanding of your own well-being. Keep exploring, keep asking questions, and as always, keep diving deep into that fascinating world of your own body.
Well said. I couldn't agree more.